everybody. Thank you so much for joining us today. Welcome to CPASS Foundation's Conversations, Community, and Collaboration platform, which is dedicated to discussions with STEM professionals about pathways and access to Black and Brown student success. I am Ginger Birkenbuell, and today I'm going to be gaining insights and tips from board-certified anesthesiologist and medical ethicist, Dr. Stephen Bradley, who has a passion for mentorship and increasing diversity in the healthcare workforce. He's also an assistant professor of anesthesiology. He combines his practice of medicine with educating medical students and resident physicians. He's also the host and creator of the Black Doctors podcast, where he interviews Black and Brown professionals in a variety of career paths. Let's learn the truth from Dr. Bradley about what Black and Brown students need to know as they begin their journey through STEM-focused schools and curriculums, which hopefully will result for them in an A-list medical residency or corporate internship opportunity. So, Dr. Bradley, thank you so much for talking with us today at CPASS Foundation.
Ginger, thank you for having me on the show. Please call me Stephen.
Oh, I would love to call you Stephen. I'm so grateful that you say that. But given that we are trying to lift up Black and Brown students, young people, I would prefer it, if you don't mind, if I called you Dr. Bradley. Would I be able to do that?
Okay, perfectly
okay,
fine.
Thank you so much. Thank you so much. Okay, so before I ask you this very typical standard question, did you always want to be a doctor when you were 2 years old? You know, things like that. I'm going to actually ask you this a little bit later. I want to really skip ahead because what jumped out at me with your bio, it never occurred to me in 1,000 million years that you could be a doctor and a medical ethicist. And I'm really curious, what is that and how did you become this?
Yeah, well, hopefully all of our physicians and healthcare professionals are ethical people in general, but the field of medical ethics is integral to a lot of what we do as physicians, as healthcare practitioners. With any specialty, whether it's engineering, whether it's law, whether it's medicine, we all have a unique code of ethics that we follow. Ethics kind of applies to why and how we make decisions in our day-to-day life, whether we're ethical human beings in general. So within the field of medicine, medical ethics deals with how we treat our patients, how do we make medical decisions with our patients, and how do we make sure everything is being performed in a way that is appropriate, that is ethical with regards to their care. So as a medical ethicist, I have chosen and been able to spend additional time studying and reading on ethical dilemmas. And I was able to complete a one-year fellowship program where we spent the year having lectures from lawyers and philosophers and other physicians and other ethicists. And we were able to take consults from difficult conversations and difficult situations that we experienced with the patients at our medical center. And at the end of the year, I completed the fellowship, and it's a certificate program where I'm able to continue to practice and sit on ethics boards at other hospitals. And within the field of medical ethics, there's different levels, whether you just are somebody that likes to read about it and study more, whether you're somebody that's completed a certificate program or a fellowship or a master's program or even a PhD, if you so desire.
Wow, it's incredible. I guess it's a whole nother level of thinking about becoming a doctor, right? I mean, because when you're little, you think to yourself, I'm going to be a surgeon, and I'm gonna help people. I'm gonna have my stethoscope, and you just heard this real oversimplification of what it's like to be a doctor. And I understand there's the Hippocratic Oath. I think many people understand it. Maybe many people don't. But to understand the depth of philosophical conversations around medicine, and that you took the extra step of getting a certificate for that, because I would imagine that every doctor doesn't do that, right? Or do they? Does every doctor do this?
No, not to this level.
Okay, right. And so what made you decide to go to this level? What was the sort of the piece that said, I want to become more than just a doctor? Because I feel like that's what that is to me.
Yeah, I love this because I'm so passionate about this field. When it comes to medical ethics, one of the biggest issues that you'll see is when do we withdraw or eliminate life-sustaining support. So you have a family member or a patient that's on life support and it's been prolonged, there's little to no chance of meaningful recovery. At what point do we start talking about what would this patient want, converting over to perhaps comfort care and letting this patient pass away? So in the field of critical care medicine, which I'm going into, and as an anesthesiologist and as a surgeon, as in these high acuity health professions where fortunately we do see patients pass away and we do see people in these critical scenarios that require these very difficult conversations to be had and these very difficult decisions to be made. I sat back as a medical student rotating through the intensive care units and as a resident anesthesiologist rotating through the intensive care unit. And I saw these conversations taking place with patients that looked like me, but the people holding these conversations did not. And as we know, there is a ton of healthcare disparities within the field of medicine. The field of ethics really looks at how and why we make these very difficult decisions. And I thought it was completely appropriate and necessary for me to involve myself in these situations. There's a level of involvement where you can enforce and create policies and you can model this behavior. And as an attending, I was able to lecture to my residents and kind of instill within them, how do we go about and approach these very complex decisions while respecting patients' autonomy, their ability to make their own decisions, while respecting patients' religious beliefs, their backgrounds, their cultures. And I thought this was a field that for sure needed more representation, and I wanted to provide that.
And so you mentioned representation and you're an anesthesiologist. I have never in my life ever met a Black anesthesiologist, ever.
Until today.
What?
Until today.
Until today. I know, really. It's just, I love this. So representation, you're a Black anesthesiologist. Why did you become an anesthesiologist versus a surgeon or some other sort of more traditional career path, right? I find that fascinating as well, that you're, to me, in a space where there's not many of us.
Yeah, as you see with medicine or any job where there's not a lot of representation, you can't be, you don't see. I was a first generation medical student, didn't really know what specialty I wanted to get into. I wasn't sure that I could even get into medical school. So my goal was to get into medical school. And I remember after my first semester at Howard University College of Medicine, I actually cleaned out my locker because I didn't know where to go from here. I'd made it into medical school. I finished the semester, but I didn't know what specialty I wanted to go into or where to go from that point forward. Fortunately, I had some classmates that actually refused to let me just walk away that night. They're like, "Oh, we'll take you to the train." We ended up hanging out, had drinks, had dinner or whatever. And I was able to kind of revisit. And I'm sure I probably wasn't going to leave medical school because I had student loans and all that. But I remember having that feeling of not belonging, of not knowing what to do next. So what I did was, the first 2 years of medical school is mostly in the classroom. And if you kind of work hard or whatever, you can get exposure to other fields. I kind of looked at what my classmates were interested in, those that knew what they wanted to specialize in, and compared that to, okay, I could see myself doing this field or that field. Ultimately, I had wanted to go into surgery. And because our trauma surgery rotation would rotate on patients in the surgical intensive care unit, very critically ill, very sick patients. So I enjoyed rounding on those patients, and I thought this must be it. I want to become a trauma surgeon. I can save lives. I can do all of this very intense medication and intense medical management and surgical management. I was operating one day, or by operating, I mean holding the camera because I was a medical student. And the trauma surgeon, Black female trauma surgeon I was operating with, started talking about, what her typical job was like. I really didn't like operating as a medical student. I didn't like being on the side of the table, but she was very kind and gracious. And we discussed other ways that I could practice critical care medicine. And you can get into critical care medicine through surgery as a trauma surgeon. through internal medicine as a pulmonary critical care physician, most typically, and then anesthesiology, because a lot of what we do as anesthesiologists is critical care. We do a 4-year residency, but I spent at least 6 months of that managing patients in the intensive care unit. That resuscitation of blood and other fluid management and medically complex patients is something that we take care of frequently in the operating room. So there's a natural kind of translation into the intensive care unit. So that is actually what pushed me to go into anesthesia. I wanted to become a anesthesia critical care physician.
Interesting. And were you thinking at that point at all about how to pay off your student loans? I mean, was there ever a thought in your head about the financial implications of your decision?
There was. So, and something that's quite controversial. People always love posting and talking about how you should never go into medicine for the money. And I'm a bit of an outlier because as much as I do enjoy helping people, I remember being in college and I was like, if I could make $200,000, that I would be super happy with that. Medicine's great. It's a stable job. It's very interesting, very challenging, very rewarding from what little I knew. I was between that and a career in music. Music is my passion, but the thoughts of
What?
raising a family as a music, yeah, the thoughts of
Music,
raising a
trauma
family,
surgeon, play
I'm all over the
guitar,
place.
trauma surgeon. Can you, let's see, I don't know what to pick. Okay, we can talk about that later, but go ahead. So we were talking.
The thought of raising a family on a musician's salary and not knowing, it was just more of a sure thing. I can go to medicine. I never met a broke doctor that I'd heard of. I mean, they thought they all made a lot of money, but at that point in time, I said, well, $200,000, if I can make that, I'll be happy. And, going into student loans, yes, student loans are there, it's a problem, but on a typical physician salary, if you budget your money, you will be able to pay off your student loans. There's public service loan forgiveness. And for people that say that if you want to be rich and you go into medicine, I think you're probably going to be disappointed, depending on how you define being rich. For me, I've always set very reasonable goals that I will be able to attain. And to this point, it hasn't changed. I'll be able to make a very comfortable salary as an anesthesiologist. And that's great. But more importantly, I get to do what I love every day at work. So to answer your question about the loans, I'm currently completing public service loan forgiveness. But if not, as physicians, you will make enough money to pay off your student loans.
Well, that's excellent to hear because I've been hearing so many horror stories about, students in all fields, but some particularly in medical fields having a real struggle. And I love that is part of your sort of internal thinking process, just to know that you're sort of methodically and intentionally moving through your career like this to understand, how to live your life, and how to how to be sustainable, actually.
Yeah, I'll go a step further with physician salaries. We make typically above the 94th, 95th percentile for salaries in the United States. So maybe I'm naive, but I have a hard time believing that someone in the 95th percentile will struggle to pay off their loans if they're, reasonably competent with money.
Well, that's good to hear. I love hearing that. So I want to pivot a little bit. So you are a doctor versus a nurse, and I'd like to understand, and this sort of gets into my question around what's stopping more Black people from going into medicine. So first of all, is there a stigma around being a nurse versus a doctor? Is there something happening that's, and especially from the Black and brown lens? And I know you're Black and I'm Black, and I can speak from that lens better. But is there a stigma around being a nurse versus a doctor? And is there a way to fix that so that we have more Black people going into medicine, even if it means going into, nursing or something like that? Can you talk a little bit about that at all? Do you have any opinions on that? Because I feel like the field of medicine is so vast, and there is a shortage of nurses, right? Of really excellent nurses. And that's what I've been reading about anyway. And they're overtaxed and tired. all kinds of things happening. But I just want to understand that everyone is not going to go to school to become a doctor. I mean, everyone can't
Hmm.
manage and sustain that intense level of education. And I'm not assuming that nurses can't do that. I'm just saying that it really is. You just have to know when you're going to be a doctor, you are going into a very intense environment in the education space and continuing on into the rest of your career, right? But is there a stigma? And is that stigma, can we break it so that we get more Black representation at all levels?
Yeah, so hopefully not so much of a stigma as of we have this history and culture of putting certain professions on pedestals. Physicians, lawyers, like, oh my God, they're the creme de la creme of society. And part of that is a hefty dose of paternalism, male dominated, male driven fields. And fortunately, over the last 40 years or so, we've worked to increase diversity in these fields, increased representation of women and underrepresented minorities, Black people in these formerly, glorified or super glorified professions. I think that placing physicians on that pedestal was to the detriment of the rest of the members of the healthcare team. And we're starting to see a little bit of that level out where we're realizing, okay, you can't just have good medicine with a physician. You need um, the rest of the team. The physician's a leader. You have nursing staff that's providing care. You have the folks in training, the medical students, residents. You have nurse practitioners. You have physician assistants, and all these people together, because we cannot do everything by ourselves. We all need to work together. When it comes to the nurse versus physician as a pre-health profession student, the nursing pipeline starts in college. So as a Black or brown
Mm,
person, depending on your background, whatever you've struggled to overcome, you've now made it to college. You're going to decide, do I go into nursing, which in 4 years I can complete that Bachelor of Science degree in nursing. I probably know somebody who's a nurse. I know this is a very reliable job. It pays pays well. Or do I chase this path of medicine, which I may or may not have had exposure to a physician? I know that pre-medical courses are incredibly hard. That does not come with a guarantee of medical school, much less a job. I know that I'm signing up for a much longer educational course. I'm signing up for just more uncertainty. And I think that's a tough decision for, an 18-year-old kid from our backgrounds to make, especially when they don't have all of the data, they don't have the representation. There's a lot of unknowns. And so that's kind of the first decision point. And then you finish 4 years of college, you're now a nurse, or you're now a pre-medical student who's graduated, and now you're applying to medical school, right? So that's that next hurdle that you have to overcome. And then once you get medical school, you have to go into residency. So I think that is responsible for a lot of that discrepancy, or where you see those paths diverge between nursing and medicine.
I see. So it sounds like, just based on what you said, that, and I know it's easier to sort of, spend a lot of time focusing on, preschool pipeline to medicine, right? I mean, a lot of funding goes into this, and programs and all kinds of nonprofit organizations are focused on getting more young people. But it sounds like it actually it kind of is a little bit important, to have early intervention of young people that are interested in medicine before they're in high school, before they get to the college level, because it almost sounds like there's this so much more education that has to take place early to prepare you for what you're about to deal with when you get to college, that it sounds like it's very difficult for an 18-year-old to decide, or a 19-year-old to decide at that point, I'd like to become a doctor. But the path to nursing is an opportunity in itself that helps them get there. And that's what it sounds like you just said, right? I mean, I
Yeah,
wish I could.
it's more attainable. Yeah,
It's
if
more
you
attainable.
go, yeah.
Hmm. That's really fascinating. I'm curious. What do you think is, I don't know that I heard the answer to this though. What do you think is stopping Black people from going into STEM fields? It doesn't just have to be medicine, but I heard you on one of your podcasts
Yeah,
talking to a civil engineer, right?
yeah,
What is the problem? Why is this not something we can break easily? Why are we not getting there? Do you know?
yeah. Again, for me, a lot of it is the representation. I mean, in addition to the factors that are intrinsic to our country, our society, how we were founded, the discrimination that occurs and continues to occur, but not knowing an engineer makes it a lot harder to go into engineering. Not having met anybody who's a physician makes it a lot harder because you don't know the pathway. And you contrast that with other um, people who have grown up in these environments, in these communities. It's just a much more difficult pathway. And then you look at the socioeconomic status and the environment and the educational systems. In medicine, we focused a lot on recent years of the social determinants of health or the structural determinants of health, kind of what, in addition to just medicine, causes our patients to be sick. And a lot of that is when you look at the distribution of the educational system, the opportunity for jobs, uh, feeling safe at home, all these other factors that come into play and ultimately distract our Black and Brown youth from being able to just purely focus on academics and becoming the best students they can become. And then that translates into um, graduate degrees.
Interesting. Yeah, there's so much work that we have to do. It's incredible. It's just really incredible what we have to do. I'm really curious before I sort of pivot to your entrepreneurship journey, because I'm fascinated by this that you're able to do more than one thing at a time. And I know that doctors have these beautiful brains that they can do that, but when I think about what's required to be an entrepreneur and a doctor, I'm still trying to figure out how you do it. But before I get to that question, I want to ask you a little bit about so you mentioned, I love that visual you just gave me of, cleaning out your locker and your friends like not letting you just leave. But it's that visual just was so powerful to me. I'm really curious, when you were in medical school and before you hit the residency experience, what was that like for you? Did you have help? Because you said you had some people that were guiding you a little bit. You said, I'm lucky I found this community. But how did you bridge the gap from medical school to residency? Because I'm understanding that that is a very difficult path to get a good residency because we don't have generations of doctors behind us plugging us and playing us into places and say, here you go, let's go, right? What was that like? Can you talk about that a little bit? And how did you do it?
Yes, I was fortunate to be at Howard University College of Medicine, one of the three historically Black universities with medical education programs. And after landing at Howard, it is truly a family environment where we had mentorship with our senior classmates. So when it came time for these standardized exams, they kind of had a program already built where, okay, we need to get these books, you need to start studying. So I knew how I did on the first board exam would really dictate how competitive I was for specialties. When it came down to picking a specialty, I was fortunate that in DC, the National Conference for the American Society of Anesthesiologists happened to be in town the year that I was a third year medical student. So I walked down the street, went to the conference with some of my other friends who had already decided to go into anesthesia. So that was my first kind of exposure to the academic community of anesthesiologists. My buddy Brandon, he kind of led the way and introduced me to anesthesia and was like, "Oh, it's so great. You get to sit down, you help patients, and you make a lot of money." He would just like kind of extol the virtues of anesthesia. I'm like, all right, well, Brandon's into it, and Brandon was always a super smart guy. I'm like, this will work for me. And I kind of followed his coattails. Whatever he did, I did. I got a competitive board exam score and put out the applications. During my application period, you can never kind of discount the value of personal relationships and networking. I went to for a second time to the National Conference of the American Society of Anesthesiologists. I met my future program director in residency for the second time at that conference because typically residency programs will go, they'll have booths, you can meet them. And then I went to the Student National Medical Association conference, which is an offshoot of the National Medical, the NMA, National Medical Association, back when the American Medical Association, which is a big group for physicians, would not allow Black people to join. That built the National Medical Association, which was for Black physicians. And then the Student National Medical Association is their student component. So every year they have a huge conference and there's residency programs that go there to recruit. So for the third time, I met my program director. And then I interviewed all over the country, but it was really those personal relationships that I was able to foster that helped me match successfully.
Wow. And so again, so I've been having conversations with so many of us Black people that are in medicine, and I'm not, but the discussions I'm having, and it's the same answer every time. The networking, the relationship development, the requirement to put yourself in the world, and to, whether you have confidence or not internally, there's almost no other path for you to get where you need to go when you're Black in medicine without doing the things you just described. How do you tell a young person who might be an introvert or who may not have those social skills that you clearly, either you had them or you developed them over time? I don't know. Like, where did it come from? So how do you tell a young person that in this day and age, which there's an extraordinary amount of distractions from social media, from the media in general, even really smart kids are getting taken under, right? Because of what's happening in media. How do you tell a kid to start learning now, and where do they learn? Do you tell them to go get a job in a retail environment so you can get some in real life experience? I mean, you're describing things that I feel like I look at some of the younger people now and I wonder, can they do that? Especially given we're coming 2 years out of a pandemic where they had no opportunity to meet people and to do things, right? So what's your advice?
Yeah, I think those experiences, that's what really ultimately propelled me and helped me be successful. You're seeing small pieces of my life, but the bigger picture, when I applied to medical school and I applied to residency, on my resume and CV were the 4 years I spent working construction, the multiple music instruments that I played, the 3 years I spent working at Walgreens as an assistant manager, the time I spent at Subway. So I worked multiple jobs, which helped give me those social skills and allowed me to interact with people. For those introverts, closed mouths don't get fed. Sometimes you've got to step out of your comfort zone. Yeah. And number two, you got to use what you to get what you want. I mean, the best way possible. What I mean by that is sometimes you have to be different to get to where you want to be. I did an away rotation out in California, UC Davis. They kept saying, "Oh, you're going to Cowtown," and I didn't know what they were saying. I was like, "What's?" I didn't know what a Cowtown was. I thought it was Cowtown. Everybody kept saying that. I was so confused. And then I was on the bus going to campus, and I saw cows in a field. I was like, "Oh, cow town." And that environment coming from Howard in DC to middle of nowhere, kind of Sacramento, California, there everybody was talking about fly fishing and going hiking, camping is something that I couldn't easily relate to. So when I say, adjust to your environment, you kind of got to look around and see, did I become an expert on fly fishing and hiking? Not at all. But what I did do in that environment was really focus on the patient that we were taking care of and prove that the one thing that we do have in common is anesthesia. I want to become an anesthesiologist. I want to learn. And that's how we kind of came together. People love talking and they love when people listen to them talk. So as an introvert, if you can just continue, keep a conversation going, ask questions to where, you're learning, you're having a meaningful exchange with whoever it is, whether it's on an interview or one of your faculty mentors or residency instructors, having that conversation gets you face time and gets you that interaction that you had even as an introvert. And it's exhausting, absolutely, especially depending on your personality, but it will pay off dividends. Now, that was my way. There's other people out there that say, I will be unapologetically my true self and nothing's going to change. And if they don't want me the way I am, then that it is, and more power to you. And I support and respect that. If that's what works for you, then by all means, proceed in that fashion.
Right. Know thyself. I always like to say know thyself, because you kind of have to have some level of self-awareness before you go into any field, whatever you're doing. And it takes some time for some people to develop that self-awareness. All right. Well, I want to switch gears because I could talk to you about so many things. I can tell that you are full of stories, Dr. Bradley. You have so many stories. I can feel it. It's coming.
One or two.
It's coming off of you. I want to talk about your podcast. You have a podcast called the Black Doctors Podcast. Why did you start this podcast? I'm curious because you're a doctor, and I have my own podcast, the Anesthesiology Guide podcast, and it is a job in itself. And I'm not trying to ask you how do you balance all this, but what made you create this podcast? What's the purpose of it? What's the goal?
Yeah, so a couple of years ago, well, it was 2020, it was a pandemic. I think a lot of people found their creative side. They had probably some time on their hands while we were all kind of stuck at home with no place to go. But even before that, I'd looked, where is my niche in the world, social media? Should I start a YouTube channel? Should I become an influencer? Should I make funny TikTok videos? What should I do? And I looked around, like people were making money off of this stuff and that. But what I noticed was the experiences that were being portrayed with the med influencers, whatever. You get to see people's successes, and you see how people glamorize medical school, and every picture people look fantastic. And I'm like, well, my experience was very different. It was rough. There was times I looked extremely disheveled while I studied at school, or when you haven't slept, you've been at work for 28 hours. And I thought that I really wanted to portray this side of medicine. So I looked at, different social media outlets, and a lot of them are very fleeting, like your timelines on Instagram or TikTok. Everything just keeps going and going. It's too fast. Nothing sticks. So I looked into podcasting. I said, hey, people listen to podcasts. They can sit up on the internet for forever. And so I spent about a month, I think, researching how do you start a podcast? So what's a host? What's a server? How do you do the audio editing? Now, I am a musician by training, and I had started dabbling in music production and recording, and that kind of really sparked during the pandemic. So, okay, I need a microphone, I need a digital audio workstation. I use Logic Pro X. And so I had the nuts and bolts of how to physically make the podcast. Now I just needed inspiring stories. And it's been my goal to reach out to just regular physicians that I know that are out there. I've interviewed some other STEM professionals, some pharmacists, I think a veterinarian, especially in that first season. I was kind of trying to fill out where I wanted the podcast to go. And my goal wasn't to go to the popular person that's got 1 million followers on Instagram so I could grow my podcast. I really wanted just regular people like myself, because we each, even you, Jinja, have your own story, which is incredible. If you are given a platform to share that story, somebody's going to sit out in the audience and listen to your story and be like, oh my God, like this is me, this is my life. And I thought we could all learn from other people. So that's what inspired me to start a podcast. It was back in June of 2020. There was a whole story. I was getting deployed, and I think, launched the first episode from training out in Texas. Long story, but it's been just over 2 years now, and I've been able to, fortunately, see this podcast grow, get feedback, and I know it's out helping people, and folks are identifying with the folks that come on the show.
I really love it. I also like that you've combined, some of your original dreams of being a musician to your career, right? And I think that it seems to me that you are an entrepreneur. You have an entrepreneurial perspective. You have an entrepreneurial mindset, even though you're a doctor. And I'm not trying to diminish being a doctor, because I love entrepreneurs. I am one. I'm a business owner. And I do believe that we are superior. We're superior. But I'm really curious, do you think that has anything changed from before the pandemic to now in terms of the requirements for a doctor? Because what I'm seeing is more people in the medical spaces and in STEM in general, more people in STEM are taking to social media and sharing content and sharing stories. And they're what you saw in 2020, where you're saying, I want to show people like us in our natural state in the wild, right? I'm not looking for like beauty. I want to meet normal people like myself versus, the Instagram celebrities, right? Are you seeing now that what's required now is different, or is this just a sort of a subsect of doctors like yourself that are sharing strategies and content? Like there was a time where a doctor would never ever go on social and pull up the curtain and say, this is what's really happening here. You'd never have that information. So
Right.
what is actually happening? Is this a, like, when you become a doctor now, just know that you also need to be an entrepreneur, because otherwise you may not have success in your career. I mean, what do you think is happening with this?
No, yeah, not at all. I mean, and I am a creative, and that's what people. I don't. I wish I were an entrepreneur. I am a creative. I am the most disorganized person. I can't run a business to save my life. But fortunately, I have a physician salary, and I can fund whatever. If I want an instrument, I can pay for it. I can buy the instrument, and then I have some time on my hands to do things that I enjoy. So that's where my drive comes from. Is I want to create and I want to help people. In the beginning with the podcast, I was like, oh man, like people are making a lot of money. There's people like you mentioned, making money on social media and side hustle. Side hustle is the thing. And initially I was like, yeah, with this podcast, I'll make a lot of money. And then after like a month or 2 months of not making any money, I was like, well, I mean, I'm not gonna quit. Do I really need much more money? Like, what do I need? I have a full-time job. I have everything that I could want with my salary. And in context, I was on active duty in the Navy for the last 4 years, and military physician salaries are half or less than what I would have made in the civilian world. And even with that salary, I was content. I was happy. I didn't need another job. And so for me, it's been just my creativity that I want to highlight. At the same time, I get to help people. And if Instagram gives me 50 bucks or something every now and then, or I get sponsors, I mean, the sponsors at least help cover the cost of the show. So that
Sure.
means, I'm not like coming out of pocket to help people. It's kind of like a double whammy, I guess. But it helps. But for me, the focus has been producing a quality podcast. Or here's my music that nobody wants to listen to, but I can't subject my wife to it alone. You all have to suffer as well. So that's what you're going to see on my social media. I came to this point kind of in 2020 after the podcast, because this growth formulas on Instagram, on TikTok, and podcasting. If you want to build your audience, do these things. And I released an episode on some specialty, and I was like, oh man, it didn't go well because it wasn't super popular. But I had like 2 people that reached out and were like, this helped me. So at that point, I kind of just stopped trying to do things that appeal to the masses. If your focus is making money on social media, then you got to do no shade, do what you got to do. But for me, it was just putting whatever I felt out. If I feel like posting something, I post it. I don't worry about the algorithms. I don't worry about the time of day that I'm posting. Does that hurt my growth? Probably. Does it hurt the income I could be making? Sure, but I don't have time for like another side hustle or part-time job. For the broader community and physicians at large, there's a lot of folks on social media, a lot of people making like significant amounts of money, being influencers and other things, and that's great, and I'm happy for them. I also know the vast majority of my friends that just go work their 9 to 5 as physicians, make a lot of money, take vacations, spend time with their family, and you will never hardly ever hear about them or see them on social media. So I think it's really whatever you want to make. Just make sure that, for me, it's what is your driver? Do you not make enough money? If you're just trying to make more money, at some point, I say you should shift your priorities to enjoying the life that we have. And money is a means to an end. It's not the end.
So it sounds like you don't necessarily think that this is the new world of becoming a doctor, right? Because
I hope not.
in other industries, content strategy, content sharing, sharing what you know with others, having a presence on multiple channels is actually a job requirement. I mean, this is really something that companies are looking for. They want people that have the confidence to be able to share a story while also protecting the brand of the company they work for. And these are people, of course, that work a job versus people that have their own companies that are managing their own
Hmm.
brands. It doesn't sound like there's been some major shift where now, hospitals and institutions are now saying, wow, we really could use a bunch of Dr. Bradleys here. We really need this is a skill set we actually need in addition to, the years and years of struggle in medical school and residency. And that's
And
kind of what I
and
was wondering, like, is that starting to
so
happen a little bit?
there is the sense of leverage. So when you get your job in academia as a physician, as an engineer, perhaps you work for a big engineering company, and that can be something that you leverage. If you have 100,000 people on social media, you can leverage that marketing with your company, and of course be very intentional about that. Definitely don't do that for free. It's not a requirement, but it can be a bonus.
Well, I love this conversation about social, and I will share that I did have a conversation with a doctor a year ago, actually a little over a year ago, and she expressed anxiety over the success she was seeing with some people on social media, right, and the financial rewards they were getting on social media, and they're also a doctor, and her decision was that's not the way I want to be a doctor. I put so much into my life and my education, my career, and she was slightly discouraged at the financial reward of people deciding they wanted to be honest about their life. And it was discouraging for her because again, she went into medicine with a very traditional mindset of what it was required to be a doctor. And this environment now of sharing content and teaching people online is not a place that she thought she'd ever have to go, right? And I think it's not for everyone. I mean, social media is not for everybody. There's a lot of engineers I know that have never and will never touch social. They are very successful at their careers. They make an extraordinary amount of money. They love what they do, just like you mentioned, and they're not feeling this call to the wild of social. But on the other hand, I also feel like when it comes to diversity and representation, I'm so grateful for people like you, Dr. Bradley, because this is the way that we communicate. This is how young
Yeah,
people listen. This is how they learn. They are not in real life now. They are on TikTok. They are on Instagram. They are on Snapchat. And when someone like you shows up and tells them the truth and in an authentic way, it's probably the only way they're getting this information, right? Given what we were talking about earlier, where there's young people that have an entire 12 years of no visualization whatsoever of being an
yeah.
engineer or a doctor. So I'm really grateful that you had this conversation with CPASS Foundation to learn about what you're doing and how you're sort of managing these conversations and being an amazing anesthesiologist. I love it. I want to see more Black anesthesiologists, just like I want to see more Black epidemiologists, right? Like I'm looking for more Black doctors everywhere, but particularly in fields like where you're studying, which I agree, anesthesiology is. I'll just tell this one story. I remember when I had my three children, and I had this false narrative. I have three sons. I had this false narrative based on some old lie of like having a baby with like pain, you know, like
Hmm.
it's a false narrative. Like you're supposed to suffer to have this child. And I remember saying, no, I'm gonna go in there and do this. I'm gonna have this baby. And I think I lasted maybe 2 minutes. I said, you know what? I felt it, been there, done that. Let's just please help me survive this process. And that was at that moment when I remember when the anesthesiologist came in, and it transformed the entire environment of the room. That transformed the doctor's response, the nurse, me, my husband, my mother, everybody changed when the anesthesiologist showed up. And that's how important you are. And I'm so glad you're here.
That made my
Anyway,
day. That's why we're here.
okay, well, thank you very much, Dr. Bradley, for this wonderful conversation. I really am grateful for you being here, and onward and upward. And everybody, I will be sharing in the notes later where you can find Dr. Bradley's amazing podcast of absolutely tremendously terrific conversations with other Black professionals. I really love the conversations. You have to check it out, the Black Doctors Podcast. And thank you so much for coming, Dr. Bradley.
Thank you. Pleasure is mine.
Okay, great. Have a good rest of your day, and onward. Thank you so much.